Hello, everyone. This is Nicholas Capman with the FDA Group. Welcome to the Life Science Rundown. Before we jump into our discussion today, just a little bit about the FDA Group. We help life science companies in the areas of quality assurance, regulatory affairs, clinical operations, commissioning, qualification, and validation, as well as CMC. We offer three different engagement models, which are consulting, staff augmentation, and full-time employee recruitment. So if you ever find yourself in need, just head over to the fdagroup.com to check us out and get in touch. So today I am speaking with Matt Lowe. Hey, Matt.
Hi, Nick. It's great to be with you today.
Appreciate you joining. So before we get into today's topic, would you kindly introduce yourself?
Yeah, certainly. So, as you mentioned, my name is Matt Lowe. I am the Chief Strategy Officer for a company called MasterControl. MasterControl offers quality and manufacturing technology solutions for the life sciences industry. Been with the company for 18 years now, so it's been a good long while. Prior to that, worked in R&D in the medical device industry. So I call that my first career.
Excellent. Well, thanks for that introduction. So what are we going to be talking about today?
I think this is a really relevant topic because it's something that we hear about pretty much every day now. And that is, what should we watch out for when we're leveraging AI in quality and manufacturing use cases in the life sciences? I think it's something that we're all kind of wondering about, maybe a little bit scared about. So I think it's a great topic for today.
Great. Well, I think a lot of people might kind of understand why life science companies are interested in AI. It's kind of the newest revolution in today's era. But from your perspective, what do you think also adds that level of interest in AI?
Well, I think it's hard not to at least be AI curious with as much as it's in the news. I mean, any kind of business media that you look at today, everybody's talking about AI. How is it going to revolutionize your business? Is it going to replace us as humans? How much easier is life going to be with it? I think everyone is hearing that and they're trying to process, well, number one, where does it even make sense in my business? Uh, where should I use it and where shouldn't I use it? And probably most importantly, if I don't use it, what is my competition doing? How is that going to impact my ability to stay competitive in the marketplace? So I know as a company, Master Control, we're looking at all kinds of use cases in our own internal business. How do we use AI, as well as how do we enable our customer base to use AI through the solutions that we provide to the industry?
Mhm. One thing I'll add about AI is I am actually reading a book called Life 3.0. I think it's the most popular AI book. Um, and it was published in 2019. I'm about a quarter of the way through. But I would, politely plug that book, Life 3.0, for anybody that wants to understand the macro perspective of what's coming. So let's get a little bit more specific into life sciences. So,
Uh-huh.
can you give me some information about some of the things that you're seeing and where AI has some applicable application?
Certainly. So, I mean, we're kind of seeing it all across the spectrum. I mean, very forward-thinking use cases. We're headquartered in Salt Lake City, Utah. There's a company here called Recursion pharmaceuticals. And recursion utilizes algorithms, AI, to generate compounds of interest. So they're using it in, the kind of the hard science, pure discovery part of the process. And then, completely on the opposite end of the spectrum, you've got sentiment analysis once a product is out in the marketplace, and looking at what's happening with your product, maybe combing through customer complaints or adverse events, things of that nature. So, all the way from kind of the cradle end to the grave end of the product life cycle, and everything in between. We're looking at some very specific use cases, and it plays into this idea of where should you use it and where should you not, and how should you approach deciding where those use cases lie in your own company. And it's something that we're very accustomed to in the life sciences industry, this idea of a risk-based approach to really everything we do. And what I'm proposing is, why should it be any different with AI? Should we not take a risk-based approach there?
Yeah. Well, I guess one argument to the risk-based approach, which is not a good argument, is this AI revolution is coming so quick, and I need to get on the bandwagon. Although we could argue that with the internet revolution or the industrial revolution, I think probably similar sentiments kind of come into play. So when we think about risk-based approaches, the kind of the big thing to watch out for is, what are the different pitfalls?
Yep.
And what are the
Yep.
considerations that we need to take when we're considering implementing AI? So
Yep.
can you comment on that?
Yeah, certainly. I think that's a great question. The thing about AI that we see is, when it gets things wrong, it gets it really wrong. And making sure that you have a way to mitigate that risk, and probably more importantly, is kind of getting your arms around what it's doing. And so we look for low risk, high value use cases. An example of that within our own solution set, within our quality management system, there is an employee training component of that. We have all these SOPs and work instructions, and they're changing all the time, and our staff needs to be trained on those changes and revisions. And so Master Control has a capability to track all of that. Well, we know that the regulators like to see objective evidence that folks are actually trained to these changes that are occurring. And so oftentimes folks will use an exam-based approach. Well, if you think about the level of effort and the resourcing that's required to create comprehension exams for every revision of an SOP or a work instruction that occurs, pretty soon you've got a person whose full-time job it is to create those exams. Well, we saw early on application of generative AI, where we could utilize that to create those comprehension exams. And now something that took, 2, 3, maybe 5 hours on the high end, by the time you get through all the stuff, can be done in a matter of minutes. And this is high value in the sense that it reduces that the man hours required to do that, but it's also fairly low risk, because you get a draft back, you keep the human in the loop that is reviewing that,
Yeah.
And now they say, oh, no, that one's goofy. I don't know where it got that, right? So this is a great example, I think, of taking a risk-based approach where we can learn
Hmm.
on low risk, high value use cases and then progress into things that maybe have more risk associated with them.
Yeah, that's a really good example. One of the things that I've been thinking about as it pertains to AI, and it's funny, sometimes I don't know if I came out with these terms or not. I think I came out with this one because it actually goes back to my days from telecom,
Mhm.
which is you need a human for the last mile. So AI can do all of the upfront work, and then you need a human to review what AI has done and give it the check or make the necessary edits. And I think that's one of the things that we're hopefully going to continue to see as AI comes out is, at the end of the day, we're in control of it. And it's nice to have a human at least review, just like a manager reviews another human. There should be an approval authority that's looking over everything that's created from AI and saying, yes, this is good, and I can sign off on it. Because at the end of the day, we need to hold somebody responsible, and we can't point to AI. Um,
Ah,
yeah.
yeah,
So
yeah.
that's a really good case. Low risk, high reward. Give me an example, if you could, about one that's the opposite, or perhaps maybe some other interesting cases, whether it be similar to what you did or different, because that's a really good point that you made.
Yeah, so it kind of going to the opposite end of the spectrum would be leveraging this in the manufacturing environment, where the machine is making recommendations as to things you should change to increase yield or reduce cost or throughput or whatever it may be. And it's a great use case because if you look at all the data that's collected during a production run, whether you're in the device industry and you've got your device history records, or you're on the pharma side and you've got batch records,
Mhm.
all of that data coming together over a long period of time, the machine is going to be really good at picking out patterns and trends in there and applying those to the current batch or lot that you're running. At the same time, if you don't understand what it's doing and what the implications of what it's recommending may mean,
Mm,
you could have a pretty disastrous outcome.
right.
It could produce a bad batch and you know it, or even worse, it could produce a bad batch that you don't know about. And so, kind of stepping into that through a series of lower risk use cases,
Mm,
you learn more and more about it. Your business becomes more accustomed to it, and folks understand what to look out for. What kinds of flags or triggers should I be watching to make sure, oh, yeah, the machine got it wrong there.
mm.
It's really good and it's really good most of the time. It's kind of like that. What's the quote from the movie? This works all of the time, 60%
Yeah.
of the time.
Yeah, yeah, yeah,
Yeah.
yeah. I've heard that one. Yeah,
Yeah,
something like that.
we got to make sure we can spot when it's not working, right? Mhm.
Yeah. Now to that point, I'm thinking you wouldn't want to implement AI right off the bat. However, you might want to have AI working in the background and not taking any recommendations because it's a self-learning mechanism.
Yep.
So perhaps if we're differentiating on the different batches and saying, okay, this is for X, this is for Y, it can at least find the similarities between all of the X's and what similarities are between the X's and the Y's so that it could implement both between X and Y. or same thing, only this change should be used for X and this should only be used for Y. And then having some sort of mechanism to determine what is the level of accuracy that those recommendations are coming out with. I've seen a lot of AI technology, and one of the cool things about the people nowadays is we understand it's imperfect. And so we can take recommendations and say, okay, that might be 70% accurate, 80% accurate, whatever the case may be. Now, a 70% accurate recommendation might suffice in one situation and not another situation. So we know
Yep.
in order for us to take recommendations from this, it's got to reach, statistically significant recommendations, and then we're in a place where we can implement it. Does that sound right?
Absolutely. And these are principles that we've learned as quality professionals in the life sciences for many, many years. We're just applying this in a different way to a set of technology that potentially uh, could change the way we do things and make us much more effective in our jobs. But I think the comforting part about that whole thing is it doesn't replace us. We're just doing things a little differently and applying our knowledge and the computer that resides up here
Hmm.
to understand this, okay, I can use this here but not here, or whoa, that doesn't look quite right. I'm going to dig a little bit deeper and oh, you know what, it did get it right. That's surprising to me.
Hmm.
And now we've learned something new.
Yeah.
So I think it's a great time to be in this industry and in this profession.
Yeah, absolutely. So the word that is jumping out to me is pace. And so we have to say, okay, low risk, high reward, no reason to wait, jump into it. High reward, high risk. Okay, we're gonna have to pace and make sure that we're waiting until we get to a certain threshold before we can actually implement. So I
Yep.
think certain applications, again, we can jump right into. Other ones we need to track and monitor before we implement. I can tell from your nodding that you're in agreement. Do you have any examples of things that you would say are low risk, high reward, in addition to what you said? Some that might also be high risk, high reward, or something in between. And because I'm sure, you've got a wealth of knowledge. People are kind of curious, is he going to be speaking to my world?
Yeah.
So,
Yeah.
how can you add some insight into that?
Sure. Sure, yeah. So another area, we talked about the exam generation. Another low risk, high value type situation that we see is summarization capabilities. This is something that generative AI is really good at today. So think again about your SOP and work instructions going through revisions. Well, it's very easy to leverage generative AI to create a summary of the changes.
Hmm.
Previously, it took somebody understanding the content to a level and then, crafting it into some words to be able to give someone, hey, here's what's changed in this document. Well, now you just say, hey, here's two documents. Tell me what's changed. And it's is very good at that. Other areas where we see some applicability, auto categorization
Mm.
of incoming quality events. So, maybe I've got adverse events or customer complaints, non-conformances, whatever it may be. The machine can look through the content of those, compare it to the body of all the other ones that you've ever received, looked at how you categorize those, and then recommend a category for those incoming events. Again, I think there are a number of these cases that are low hanging fruit
Mm.
that pose low risk at the same time. Um, Now, if I think we'll get to this point, but I don't think we're there yet. And this would be, more of a high risk, albeit high value type use case would be, I've got a kappa and I'm going to let the machine perform the investigation, recommend the corrective and preventive action, implement it, track and trend it. But I think we're pushing too far
That's a lot of
in that case.
steps.
Yes, it is.
Yeah.
And
Maybe we
what
could
at
start with
what
the first step.
yeah, well, and to your point, human at the last mile, or we call it human in the loop, when you remove those checks, that's where I think you start to get into trouble and there are pitfalls there.
Yeah.
That and in the life sciences, I mean, it doesn't happen all the time, but certainly when we do things wrong, people can get hurt.
Mm.
And that is what we're trying to avoid
Mm.
as quality professionals.
Right.
So keep that human in the loop.
Well, the other thing, just from a control perspective and cost perspective, is by human in the loop or last mile. I think you could potentially avoid some validation requirements.
Yes.
And I think everybody's really excited about that,
Yeah.
right?
Yeah,
Yeah,
it's that whole validation versus verification,
right.
right? With human in the loop, you've
Yeah,
got verification, which
a
helps
lot
you on the
easier.
validation side.
Yeah,
Yeah. Yeah.
absolutely.
Totally
Uh,
agree.
yeah, and you mentioned summarization, and I wanted to let you know, Matt, and everybody listening, my life has changed recently. So we just implemented at the executive level a bot, and you're actually being recorded now, Matt, by an application called Fireflies. And Fireflies is going to send me a summary of this meeting. It's going to send me bullets on all different topics. So we talked about AI, we talked about introductions, we talked about yeah, any sort of topic will be separated and bulleted. And then it will also give a conclusion of the meeting and it will give next steps. So I have a notebook, but I really don't need it anymore because of Fireflies. There's another application that our marketing team uses called Otter, um,
Mhm.
like OTTER. And so for anybody out there that is interested in those types of applications, I would highly recommend it. It's absolutely fantastic. So I just thought I'll be waiting for my commission check from those companies. So
Yeah, in fact, your Fireflies application sent me an email just before we started here and said, "Hey, this is what's going to be happening.
Mhm.
Click here if you too would like a link to the summarization." So, yes, really cool use cases out
Yeah.
there.
Now, not only did it send you that for your own benefit, but it also complies with some state regulations. So
Yeah.
just for everybody listening, Fireflies, well, I shouldn't say unfortunately, but they give you the option of whether or not to send it out. I would highly recommend if you're going to be recording anybody that you notify them, because if you don't, you will be not compliant with some state regulations. So just make sure if you implement something like this, everybody is always notified that you're being recorded. Yeah. Um,
Yeah, I've got a funny story for you, Nick. We utilize a similar thing in the sales side of our business. So these types of Zooms, there's a bot that's present there. And in the beginning, it had a name. And yeah, I can't even remember what it was, a person's name, right?
mhm.
And the customer that was on the line, that they're going, "Hey, who's Bob?" I said, anybody know Bob? I don't know why Bob's in here.
Yeah.
Like, and our salesperson also didn't know that the bot's name was Bob.
Oh,
And so they terminated the call thinking that there was some intruder in the Zoom. It was
oh,
hilarious.
that's
It's just,
funny.
yeah.
Yeah. Our bot's called Fred. Fred from
Fred,
Fireflies. Yeah.
there you go.
Yeah.
Yeah.
Absolutely. So we talked a little bit before we jumped on about the 3% problem.
Yep.
Can you explain what that is to the audience?
Yeah, I mean, that's kind of going back to the 3% of the time that it gets it wrong. And the margin of error is closing there. And I think it will. The thing about AI is you get to 98, 99%, and that last 1% is really, really hard to close. And so whether it's 3% or 1% or 10%, you know, what do you do when you're in that margin of error? And again, I think that just comes back to this idea of the human in the loop, making sure that you're able to pick that up and catch that and not moving to a point of automation that you just blow right through that and bypass it and end up in a really unfortunate situation.
Yeah, yeah. And having the appropriate level of scrutiny. One of the things that I hope people are doing is when they're in the last mile or the human in the loop, that they're not just taking AI and saying, "Well, I'm sure it's great," because at the end of the day, you'll be the one authorizing what it produces. So, yes, it's going to be very accurate. Yes, it's going to make your life a lot easier. But if you don't give it the appropriate level of scrutiny, you might find yourself in some hot water.
Yeah.
Yeah.
Yeah. Yeah. It's several years ago at one of our customer events, we had Ken Jennings come talk to us. You remember Ken from Jeopardy?
Mhm.
I mean, this was before, you know, Chat GPT, obviously, and all AI was kind of a normal word in the mainstream. But he talked about when he played against Watson.
Oh yeah, I
And
remember
yeah,
watching. Yeah,
yeah.
IBM.
And he said it was really good, scary good. And I mean, we're talking this is probably 10 or 12 years ago.
Mm.
But he came back to this idea of the 3% problem. He said, when it gets it wrong, it's so wrong. And
Um,
that's actually helpful
that is
because it
good. Yeah.
makes it easier for us to spot. So if you think about it in terms of traditional risk management and FMEA framework, your detectability is high in that case, right?
Mhm.
Uh, With generative AI, I think it changes it a little bit. The detectability goes down because it can be so believable. And this idea of hallucinations in the AI is very real. And I think it's going to get harder and harder to detect.
Yeah, interesting. I was not aware of that. That's really, really neat. Well, it sounds like you and the team at Master Control have been doing a lot of really innovative things, and that's, certainly exciting. And I appreciate, all of the input that you've provided in terms of cases and, high risk, high reward versus low risk, high reward. So I think this has been a really, really useful podcast. What would you like to leave the audience with before we close?
Sure. Don't be afraid. AI, I think, is a wonderful tool in our toolbox. I don't believe it's going to replace us. I think it's going to make us better, more effective. I think it's going to allow us to create higher quality, lower cost products. And I think that's exactly what the healthcare system worldwide needs. It's just understanding where we should use it, where we shouldn't, and what we should look out for. And hopefully we can all figure that out together.
Yeah, awesome. Well, Matt, this was really, really awesome. I appreciate all your time and your insight. And for everybody listening, as always, if you find conversations like this valuable, please share it with a colleague or your professional network. If you haven't already, subscribe to get updates of new episodes at thefdagroup.com/podcast and follow the FDA Group on LinkedIn. If you'd like to connect about project or resource needs, head over to thefdagroup.com to get in touch, or feel free to connect with me personally on LinkedIn. Thanks so much for tuning in, and we'll see y'all next time.